In today's Woman's Doctor, do you have pain stemming from your shoulder or neck? It can be confusing for both patients and for doctors. Shoulder problems like rotator cuff tears and arthritis can mimic neck issues and vice versa. Mercy Medical Center Dr. Justin Park says with a neck issue, patients will often have a herniated disc causing numbness that will go all the way down the arm and into the fingers. And Dr. Park is joining us this morning with more information. Thanks for being here today.
How you doing? Good morning.
I'm good. So let's talk first about the neck issues and the herniated disc. What can you do about that?
So the first line of treatment for a herniated disc in your neck is just giving it some rest, activity modification, things like anti-inflammatories, Advil, even Tylenol is very helpful. Oftentimes just taking it easy and taking some of those medications within a week or two, those symptoms will start to improve.
How do you know if it's a herniated disc? Do you have to do an MRI?
Not initially. I think symptoms of herniated disc are pretty classic in that you start to have some neck pain in the ensuing days. That neck pain may start to travel into your shoulder blade, and then oftentimes it'll go down into your shoulder and sometimes all the way down into your hand and fingers. It's usually a self-resolving thing. 85% of the time, within 4 to 6 weeks, the symptoms completely abate. So jumping to an MRI is not always necessary.
And how about those rotator cuff injuries? Why does that translate into pain in so many different areas of the body?
So rotator cuff injuries are also so very common, especially in that same age group of patients who are experiencing herniated discs in their neck. They can also have rotator cuff problems in 10% of MRIs. You'll see abnormalities in both the rotator cuff and in the neck in people over the age of 50. And in people who have a herniated disc in their neck, 1 in 4 of them have discrete shoulder pain that almost makes it very diagnostically challenging to figure out, is it really the neck or is it really the shoulder? But again, most rotator cuff problems with a period of rest, activity modification, anti-inflammatories and physical therapy will self-resolve.
And sometimes you have to do extensive physical therapy, and sometimes you also have to do surgery for that as well.
That's correct. Again, not every single problem will resolve with therapy. My rule of thumb is that if you've had 6 or 8 weeks of therapy that's guided by a physical therapist and you're still having issues, then probably at that point it's a good idea to make an appointment with an orthopedic surgeon.
You mentioned the over 50. Is that just when parts of your body start to break down?
It's not this magic or golden number, but a lot of the studies kind of make that as a benchmark, so to speak.
Yeah, I was just joking. My producer said in my ear, asking for a friend, of course.
Yeah,
that sort of question. All right, yeah. Doctor, thanks so much for joining us. Really appreciate it. Have a great rest of your day.
All right, you too.
You're welcome. If you have any other questions or you'd like a referral, just call 1-800-MD-MERCY.